Why are the ages different regarding reporting rules for unlawful sexual intercourse versus lascivious conduct, lewd and lascivious conduct? Brief reminder, when the law says we must report unlawful sexual intercourse, it says when a minor is 14 or 15 and they're engaging in sexual intercourse with somebody 21 years of age or older, we must make a report. With lewd and lascivious conduct, it says where a minor is 14 or 15 and they're engaged in lewd and lascivious conduct with somebody at least 10 years older than they are by birthdays, we must report. Your question's a good one, and I have mostly hypotheses about why that difference. There is no kind of concrete answer that I have for you. It doesn't say in the statute. The legislative history is not particularly helpful here as well. So I can offer you my sense of why the legislature might have made this distinction. During the time that they changed these two laws, and that was in 1998, there had been a lot of literature about there had been a lot of literature about a substantial increase in teen pregnancies. Okay, so the teen pregnancy issues were in the forefront of the thinking of legislatures when they passed the law. And so they were trying to reduce the likelihood that kids were going to get pregnant. And you may say, well, a very good question is why the distinction, why saying, well, can't you get as pregnant with a 14-year-old boyfriend than you can with a 25 or 30 or 35? Absolutely. But the research suggested, and continues to be the case, although less so, that the modal relationship between a 14 or 15-year-old girl or young woman who gets pregnant is with a man in his middle 20s. So the legislature, I think, there was trying to respond to the literature on teen pregnancy and saying to us, report it if there's this age differential. There was also a concern, I think, based upon that age differential, that there's less and less kind of choice in the matter or voluntary behavior for the 14 or 15-year-old, and more duress, more potential for the power differentials on the basis of age to influence the child's behavior. I think the reason for extending or having a longer period during which one can engage in lewd and lascivious conduct with a person who's older without having it be a mandated report had to do with the reality that many, many kids are engaged in lewd and lascivious conduct, that while it does lead to sexual intercourse, it doesn't always, and that those kids engaged in that behavior are engaged with people who are of a variety of ages. And the legislature, I think, just in a very pragmatic way, was saying we probably shouldn't regulate this behavior as closely because we'll overwhelm CPS with reports that they really can't do anything about. So my sense is that this was partly pragmatic and partly a desire to have some limitation or some basis for state intervention when there is a minor who's actually engaging in intercourse in the kind of relationship that typically the research shows is resulting in teen pregnancies. You know, this is the central issue that we face when we're working with teens often, or even with young kids who are engaged in what, you know, we typically have called playing doctor. The potential effect on the therapeutic relationship of reporting fairly common behavior in minors. And there are two pieces to this puzzle from my perspective. The first one is that the law is very clear. And it says to us, for example, that we must report when a minor is engaged in oral copulation with anyone of any age. So if we have two 15-year-olds engaged in oral sex, it's a mandatory report. As preposterous as that may seem to many of us, it's clear. And so my sense is because the law is so clear about it, we should be making those reports. The way I think about the ethical concerns here and try to address it is that this is very much an informed consent issue. When I start working with adolescents, and I've worked with adolescents over the course of many years, I am very explicit with them about, at the outset of treatment, about what is private and what is not. And I intentionally have a conversation with them about the fact that there's certain behavior of kids that I have to report that may not make a lot of sense to them or to me. And I am very explicit and say, for example, oral sex, I have to report no matter who you engage if you tell me you're engaging in oral sex. Same for other types of sex, including anal sex. And kids either blanch or color, or they say, "What's up with that?" or they laugh. And sometimes it's opened up some great conversations about sexual behavior. But what I'm doing is giving this minor the opportunity to think about whether they want to say them. It increases my confidence, although I'm completely sure, but it increases my confidence that if 3 weeks later this 13-year-old or 14-year-old boy starts describing to me an experience of oral copulation, that he's probably asked intervention. Nonetheless, the on the child abuse reporting issue, how common the struggle is around reporting of sexual activity of minors. I think those of us who work with adolescents struggle with this regularly. I an unusual question or concern, which has some bearing on my notion of being politically active in this regard as well. I regularly teach the and an assessment class, and over the past 13 years or so that I've been teaching it, and I usually teach it 2 or 3 times a year, maybe to a total of about 60 or 70 folks. This issue comes up regularly. And I would say that at least a third of the people who are in those classes voice concerns about the potential for undermining therapy by having to disclose what is common and likely not abusive among minors, but behavior that is not Now, related to this question, what the law says about reporting sexual intercourse between two 13-year-olds. Okay? And this is actually, was reflected in a case in the late 80s where two 13-year-olds, or it may have been a 13 and a 12-year-old, engaged. The 13-year-old became pregnant. And the question in that case was whether child abuse report had to be made. I'm going to put aside pregnancy for the moment and just speak to the issue of sexual intercourse. The 14 or 15-year-old with somebody at least who's at least 21 years of age or older strongly implies that when two 14-year-olds engage in sexual intercourse, it's not a mandatory report. It also seems to suggest that if minors are under the age of 14, it's a mandatory report. Okay? However, the case that I was just referring to was brought before the courts under the lewd and lascivious section. In other words, they included, for that particular case, they included sexual intercourse, and this is the courts and laws being sometimes conflicting and sometimes not consistent. They included sexual intercourse as part of lewd conduct. And in that regard, the court ruled that when there are two minors under the age of 14 engaged in sexual conduct that is voluntary, they're close in age,